Well, I was born in Nigeria, Lagos. I left the shores when I was 18 years and moved to London. I worked in London, and then I immigrated to the United States about 20 years ago. Went to college and medical school in Tennessee on a full scholarship. Then I did my residency in general surgery in New Jersey. After my general surgery, I worked as a general surgeon and trauma surgeon for a year. And then I went to do a vascular fellowship in New York. After I finished vascular fellowship, I then came down to Florida to start a practice. I have the background in vascular surgery, did a 2-year fellowship. We read thousands of ultrasounds. I also have a registered vascular technologist that does the technical part of the study, and I read the study. Yeah, so it's a very important component of diagnosing and treating venous disease to have good ultrasound imaging and good diagnostic ability. I'm a board certified general vascular surgeon. I have the experience from general surgery and vascular surgery. I trained specifically in just arteries and veins for 2 years. I also have a master's in public health from Johns Hopkins, which is a premier public health institution. I kind of look at the whole patient, not only medical treatment, but other things that I can offer the patient. I think the public health background does help with understanding areas that patients may not be knowledgeable about in terms of nutrition, in terms of lifestyle modification. So just looking at the whole patient has added a different perspective to my ability to treat patients. I also did more training in managing venous disease. I've gone for a lot of courses in minimally invasive therapy because I think it's important to offer patients minimally invasive options first before surgical options, because surgical options are usually more risky and it's kind of just a harder hit to the body. So I tend to focus on minimally invasive options, but I can also do surgical options if needed. I think that's the difference. A lot of physicians that do venous treatments cannot offer surgical options, which sometimes are important, and kind of understand the full spectrum of disease and avoid the more complicated problems. But I deal with even the complicated ones, the congenital problems. I can deal with that easily as well. So I don't just only deal with the cosmetic or the smaller problems. I can also deal with complex problems if they arise.